Affordable Care Act, or Obamacare, is having here in Maryland. While the state touted its total enrollment of 329,000 people, the number who actually signed up for an individual plan is a little less than 68,000. So that means a vast majority of the people who signed up were placed in the state's expanded Medicaid program. Now, even more troubling for our state, it completely missed its target enrollment in the private plans. Based on a September memo from Maryland Taverner to Health and Human Services Secretary Kathleen Sebelius, Maryland's targeted goal was 150,000 enrollees. So that means the state missed its goal by about 50%. And of course, even though those numbers are even more fuzzy because we still don't know how many of those people who've signed up who've actually paid their first month's premium until they actually make that payment. They're not actually enrolled in the plan and getting coverage. And almost as soon as that report came out, it became fodder in Maryland's gubernatorial race. Doug Gansler fired off another attack, Lieutenant Governor Anthony Brown, saying it shows Brown's failed leadership. So joining us to talk about the impact these numbers are going to have on the race is Dr. John Bullock from Towson, political science professor, joining us again. Last time you were here, we were talking about the leadership comments in the military, and you gave that round to Brown.
Right.
What about this time?
Well, this presents a problem for Lieutenant Governor, so I'd really have to give this this round to Doug Gansler. I mean, what's happening here is that we know that Brown was touting the health care exchange as being something that he was leading and being the champion for the state of Maryland, and it clearly has fallen short of the goal. The fact that only about 45% of the goal has been reached, and we're really at 45 as it relates to 50 states and the District of Columbia, so we're not really doing that well.
So what's the Lieutenant Governor going to have to do? I mean, this is, we're expecting this to happen, but I guess the Gansler camp decided to wait late in the campaign. Right.
I mean, there'd already been a discussion of a report that may be coming out regarding the health exchange website prior to the election, but this is something that's really something that's going to put some fuel in the Gansler tank. Probably Missouri as well will probably have something to say about it, but given that Gansler is one of the sitting as the front runner or behind the Lieutenant Governor, this would actually be something to be useful for him coming into the election. And the fact that we're only less than 2 months out is really going to be a significant piece.
So is there anything he can do to kind of combat this? Because this was, like you said, this was his signature involvement.
Well, it may be consistent with what's happened recently, which has been to not discuss it. So most of the time when the Lieutenant Governor's been asked about it, the Brown campaign has said, you know, we're not going to discuss it, we'll discuss it in a different forum. There's also been a discussion about the potential debates, whether they'll happen as scheduled. So from the Brown perspective, it would probably be to de-emphasize it, not talk about it as much, but it's still a problem given that it was such an emphasis at the early portion. And at the same time, Gansler is really going to pounce upon it and keep hitting until the election day.
And then there's already debate about the debates, the fact that a third debate is not going to take place.
Exactly, and then that will lead, again, if it's not handled properly from the Brown campaign, that will lead one to say, well, are you ducking the issues? Are you ducking this big issue that's the elephant in the room? And then by not having the conversation, not having a debate about it, it will lead to further skepticism.
Now, where does Heather Missouri play into all this?
You know, it's interesting because both the Missouri campaign and the Gansler campaign issued a joint press release saying that how, you know, the debates weren't happening as scheduled. So I'm sure that the Missouri campaign would also mention that this has been a bit of a failure. At the same time, I know the pivot that Brown may do is to say, well, this is an attack upon the Affordable Care Act and therefore an attack upon the president and Democratic Party. So that's probably how he would try to spin it. But both the Gansler campaign and the Missouri campaign are pretty well primed to actually use this to their favor.
And with this report coming out, obviously this is going to be a difficult situation for the midterm elections, too, just beyond our...
Right. So again, if we're looking at elections throughout the country, if people say, well, look, you know, and throughout the state and say, well, what's been the result for this? Looking from a partisan perspective to say this has been a big element of the Democratic Party platform, and if it hasn't been successful, why hasn't it been successful? It speaks to leadership. It can also speak to execution. So it's likely to have an impact on the campaign. It'll just be interesting to see if it's a top issue for voters.
All right, Dr. Bullock, I think we're going to be seeing you again real soon.
I'm looking forward to it.
All right, thanks a lot for coming in.